channel.
Welcome back. A simple mouth swab can reveal your genetic predisposition and can help doctors direct treatment. Many doctors see this as the future of medicine. Sounds like a big overstatement, but it's not, according to those who are practicing it. Dr. James Barber, Chief Medical Officer of Vista-Healthcare, is with us. Thanks for being here.
Thanks,
You're in town in Knoxville to give a talk on this very subject.
Yes, I am. This is the future of medicine. I mean, basically, I'm giving a talk tonight for about 25 doctors, various specialties, looking at how medical interactions and how patients handle medications can affect adverse effects. We know in this country right now there's more money spent on adverse effects from medication than there are on medications themselves. So we can now look at what we call personalized medicine. Look at you and say, this is the best medication for you. This will help you. It's not, try me, take 2 aspirin, call me in the morning. It's not, trial and error. It's for you.
And we talked about Angelina Jolie. She was highly publicized for finding out her predisposition for breast cancer. She went through some genetic testing and found that out. This is something that will be available and is available to people who aren't movie stars.
Absolutely. What you're looking at now is various phases of genetic programming in medicine. We can look at the fact, like Angelina Jolie, predispositions. Look at you and say, okay, you have a predisposition for breast cancer. She had an 80% increased risk of getting that, and she averted that by doing things. In the future, medications will be devoted to look specifically at that gene and shut it down before it can actually work. But there are other forms of genetic medicine where we can look at medications people take, pain meds, Plavix, Coumadin, beta blockers, all these things that we take in a cardiovascular risk, all these things we take in a pain risk, and look and say, hey, we may help prevent you from becoming an addict. We may help prevent you from overdosing. I gave you the example. Twice as many people in the United States die from overdoses from pain medication that may be written or getting from somebody else than there are from opioids and from codeine and heroin combined. So we can look at these things now and pretend and prevent and predict these things and hopefully prevent things from happening in the future.
And these genetic tests are pretty quick. You take a swab, it's back in 7 to 10 days, and you learn this, and then do you take it to your family doctor and say, here are the results, what do we do?
Well, that's why we're talking tonight to these physicians. The doctors can do them in their office. Basically, it's a swab. You just take around the inside of the mouth, you stand it up for 20 seconds, put in an envelope, it's sent to the lab. Within 7 days, the lab comes back. Your genes never change. What we will do is give a card to every patient. He'll have that information, almost like a little app on his phone, that'll tell him for the rest of his life. So if you're on a vacation someplace and you have a heart attack and they want to put a stent in and they're going to put you on Plavix, you can look and say, hey, don't do this. We actually give a readout to the doctor and to the patient. It'll have a green box that says, this is great, go ahead and take it. Yellow, hey, caution, slow down before you take this. Or red, hey, you better watch out with this because this could really hurt you. Here's an alternative you can take. Here's an alternative dose. Here's an alternative medication.
Fascinating conversation, Dr. Barber. Only scratched the surface, but we appreciate your time.
Thank you so much, John. I appreciate you having me here.
Absolutely. We'll be back in touch, and we'll be back with more 10 News at 5 right after this.